Okay, now we are going to discuss about a topic from microbiology, that is gonococcal urethritis. It is gonococcal urethritis. See, it is caused by causative organism is Neisseria gonorrhea. It is caused by Neisseria gonorrhea, the causative organism. It is a gram-negative diplococci, kidney-shaped diplococci. They are arranged in pair. Okay, just remember the name, and now we'll go into the story. A person is having sexual contact with the gonococcal urethritis patient. After he is having the contact in the person in the urethra, this gono this Neisseria gonorrhoeae diplococcus will attach to the mucosa. And now you may ask why they are not washed off when the urine is passed. They are not washed off because they have structure known as pili. They have pili. This pili helps in anchoring adhesion and helps to colonize. So because they are there, the pili it pili are there, so they are not washed off and helps in colonization. So this is the virulence factor 1. Okay, then, and there is one more thing called, in the mucosa, in the normal mucosa, there is IgA, immunoglobulin A, which protects us from infections, which protects the mucosa from infections. But this Neisseria gonorrhea produce IgA protease. What does this IgA protease do? This destroys this IgA, so the defense mechanism is lost. So we can take this as virulence factor 2. Then this Neisseria gonorrhea produce one more substance called opaprotein. This opaprotein helps in, this one also helps in adhesion like this, like pili or fimbriae. It glues to the surface. It helps in gluing to the surface, opaprotein. So this one we can take. It is also helps in what, gluing, adhesion and colonization. So we can take this as virulence factor 3, right? And there is one more protein which helps the bacteria. See, this is a neutrophil and here is a bacteria, here is a diplococci. Now whenever this neutrophil attacks here, it has a preventive mechanism. This is known as pore protein. This pore protein helps to what, to oppose the phagocytosis by the neutrophil. So it is opposing the phagocytosis by neutrophil. It is pore protein, and we can take this as virulence factor 3, finished, right? 4. And now there is one more thing which is produced, that is lipo-oligosaccharide. What this does is, see, if this is the lipo-oligosaccharide released by the our diplococci, this attracts the neutrophils. Okay, where all this is happening? In the tissue only, right? There is mucosal tissue. Whenever this neutrophil come here, some of the neutrophils also get dying. Some of the Neisseria gonorrhea also will be dying. Some of the bacteria will die. Some of the neutrophils will die due to what defensive mechanism by gonorrhea, and some of the normal tissue will also die due to inflammatory reaction. So this dead bacteria, this dead neutrophils, this dead tissue will all form pus. This is the mechanism of formation of pus. Okay, so purulent pus is formed, and this lipo-oligosaccharide we can take as fifth virulence factor. Okay, then we'll discuss further. See, this is the urethra, and whenever this gonococcal, what Neisseria gonorrhea attaches here and damages the mucosal epithelium here, this heals, the mucosa heals by fibrosis. The after getting damaged, it heals by fibrosis. So see, if this is the what, if this is the diameter of the urethra, it is here, it is getting what, narrowed, right? Narrowed. The person may land up in dysuria, or due to here there is inflammation, right? So there might be burning, micturition. Okay, why dysuria? Because healed by fibrosis, and lumen, size of lumen is decreased, narrowing of lumen. And again, what we had discussed, pus, right? We had discussed pus formation by damaging of neutrophils, damaging of tissue, damaging of bacteria also. This pus will come out from the urethral orifice. It appears like semen. It appears like semen. Okay, this is purulent pus, appears like to be semen. Okay, then what else we can take is, if in case this this infections like pus formation or dysuria or burning micturition are left untreated, it might also ascend upwards. After urethra, what is there? We can go into what? First we can go into prostate, then we can also go into where? Testicles we can also go. Here it might cause prostatitis in the testis near the epididymis. It might cause epididymitis. Okay, it might cause epididymitis and prostatitis also, it might cause. Okay, in case of female, what it can cause in case of females? See, in the females, this is the uterus, and here is the cervix, and this is the vaginal orifice, vaginal opening. See, the vaginal pH and the mucosa, pH is less and mucosa is thick, right? So due to low pH and mucosa is thick, the females are less prone to get affected by the Neisseria gonorrhea. So, but in premenopausal women or postmenopausal women, the pH may be increased and the thickening of vagina will be less. So they might be more prone than menstruating female. Okay, for some reasons, if it ascends up, it enters the fallopian tube and it creates inflammation in the fallopian tubes, and the inflammation heals by fibrosis. The inflammation is healed by fibrosis, and the fallopian tubes are blocked due to fibrosis, and this leads to infertility, and this might lead to infertility. Vulvovaginitis. Okay, this may also occur. This is only that the conditions we discussed, right? Low pH, mucosa is thick, increased pH, or less thicken in premenopausal and post-menopausal, that is leading to vulvovaginitis. Then it might also cause to infertility because healed by fibrosis. Okay, one more concept is there here. Whenever a pregnant female, the fetus passes, if the woman is affected by Neisseria gonorrhoeae, if the fetus passes, the fetus which is passing through the vaginal birth canal, the conjunctiva of the infant may get purulent pus. Why? While passing, he might also get what contact with the bacteria, so his conjunctiva may get affected. This is called ophthalmia neonatorum. This is called ophthalmia neonatorum. This condition is known as ophthalmia neonatorum, where while the child is passing through the birth canal, his conjunctiva may get what contact with the Neisseria gonorrhoeae if the mother has, and his conjunctiva may get purulent pus exudate. So this is condition is called ophthalmia neonatorum. Okay, these are all the condition which might happen. Now we are going to discuss about the lab diagnosis. Lab diagnosis. Okay, now let's make this also very simple. Okay, first one is specimen collection. What specimen we can take? We can take the pus which is coming out from the urethra. See, if we can't get enough sample, we can massage in the prostate region, and we can get our sample from the urethra. Okay, and in females we can have endocervical swab in females. Okay, and in children, in neonates, we have conjunctival swab. Okay, these are the specimen collection. And now transport media, in which we can transport in Stewart's medium. What is the transport medium? It's the Stewart's medium, the specimen, and we had transported it. After that, in microscopy, after gram staining, we can see gram negative diplococci in neutrophil. These are engulfed by the neutrophil, right? So they are inside. Gram negative diplococci arranged as single pair. See, why these are resistant still, means why they are not getting destroyed by the phagocyte, because we discussed about pore protein, right? So remember that we are somewhat revising every time while teaching the topics also. So it is due to pore protein, which is because it's not destroyed the Neisseria gonorrhoeae. Then in the microscope it is gram negative diplococci. Okay, Then after microscopy, we'll go near the identification or confirmation can be done through, not confirmation, we can identify means more far, that is this uh, Neisseria gonorrhea contain cytochrome C oxidase. This cytochrome C oxidase gives the oxidase test positive. So it is oxidase positive. The Neisseria gonorrhea contains cytochrome C oxidase, so it gives oxidase test positive, and this positive test can be known by purple color. Okay, it imparts purple color on positive test. Due to this, we have oxidase positive test, and it is also catalase positive. Okay, one more. It only, okay, here I'll write. It only ferments glucose. It will not ferment maltose or sucrose. It only ferment glucose. It will not ferment maltose or sucrose. And then we can also identify by Malditoff. Okay. Then molecular methods, the student friendly thing every student wants to write. Even I too want to write it. It's nothing but PCR, molecular method. In the molecular method, we can write PCR. This PCR is targeted against 16S and 23S type of RNA. Okay, this molecular method is what targeted against 16S and 23S type of rRNA. Okay, and what is the treatment? The treatment will be third generation cephalosporin. The third generation cephalosporin, one example, that is ceftriaxone. In the pharmacology session, I had told a very simple and what classification of cephalosporins, and I had told many mnemonics to remember the first generation, second generation, third generation, and fifth generation cephalosporins. And go and watch that video. It is in our channel, so you can remember this third generation. What you can what to say? What you can remember. You can remember it easily when we say third generation cephalosporin. Our trick there is, okay, this is ceftriaxone. It is 250 mg IM intramuscular. Okay, this is about gonococcal urethritis. Thank you.